Professor Crabb, welcome.
Nice to be here.
Let's start with the state that everyone's talking about, Victoria. There were 300 new cases in the most recent 24-hour period. That's well down on the last couple of days where it went over 400, of course. Does that mean perhaps we've turned a corner? Is that overly optimistic? How do you read the figures?
Probably is overly optimistic to say we've turned the corner, but I think the last 3, 4 or 5 days have suggested that we're not still going up. And that means that the measures introduced a few weeks ago are having an effect. There's no doubt. We know the lessons from other places. We would have skyrocketed from here. So the measures are having some effect, but are we turning the corner? No, I think it's too early to say.
We've now got a situation in Victoria where defence personnel are going to be helping with that contact tracing when people confirmed to have the virus don't answer their phone, which has been the case. Is it a good idea to have the Army doing this kind of work, or is it too heavy-handed? I know there's been mixed reactions in Victoria.
No, I don't think it's a terrible idea to do things like this in the case of an emergency. I know it seems heavy-handed because they're military personnel, and I'm sure it's being handled very sensitively. I don't think it's sustainable, however, and it's not the sort of indicator of a very strong public health response. I think it's a sign that we've got some improving to do at how we get to the community in all sorts of different ways. But, you know, for now, for the situation we're in and the anxiety that's around acting quickly, I think it's a reasonable course of action.
Scott Morrison says the National Cabinet is aiming for suppression of the virus rather than elimination. Why are authorities not talking about eliminating the virus? And what did you make of today's commentary around the National Cabinet reasserting its position around this suppression strategy?
I think it's a matter of definitions. You know, technical elimination is actually quite a hard thing to achieve, but the elimination of any community transmission of COVID, which is also hard to achieve, is, however, achievable. 6 out of Australia's states and territories have achieved it without even directly attempting it. And, of course, New Zealand has achieved it. So elimination, not having any COVID, nothing coming in at our borders is not realistic. But elimination of community spread, which I believe the federal government and the state government want, is achievable.
The Acting Chief Medical Officer, Paul Kelly, spoke alongside the Prime Minister. He was asked about a study by the Kirby Institute, which has estimated the actual infection rate could be 1 to 2% of the Australian population, which is much higher than the official figures actually show. He answered that he doubts the infection rate is even 1% of Australians. Now, first of all, do you have a view on what that figure might be?
Well, the study is by a very good group, but it's based on serological surveys. And, you know, the jury is still out on how good serological surveys are when the prevalence rate is very, very low. And in a country like Australia, we know we have a very low prevalence rate. And the reason is these tests have a false positivity rate that might be in the range of 1% or so. So I agree with Paul Kelly. I would be quite sceptical about that result, and it might turn out to be true, but I think we'd need to look at that very closely before we started thinking 1+% of the Australian population has had COVID.
Why is it important to know?
Well, it's important to know how well we're going at detecting the virus. You know, a number like that would suggest that 50 to 100 times the number that we are detecting are out there in the community. That just seems very unlikely from what we know in other places where it is most common, especially in people over 20 or so, to have some symptoms. And of course, there are asymptomatic people who transmit the virus, but most people have symptoms. We have a high testing rate in those who have symptoms. We're definitely going to be missing some people, but the likelihood of it being, you know, we're missing 100 times the number of people is quite low. If that was happening, that's very serious when we think about trying to eliminate or suppress the virus. It suggests we don't know what to do.
There's been criticism this week of the behaviour of some people, particularly in Victoria. That's come from both Daniel Andrews and the Prime Minister, Scott Morrison. How worried are you by that data that appears to show a lot of people aren't taking isolation seriously for whatever reasons? Obviously, there's a range of reasons why this is happening.
I think you're getting at the heart of epidemic and pandemic control. You know, how do you influence people to do what you want them to do? How do all the different, many and varied subsections of our community stay informed and stay motivated? And I can tell you, they're not all influenced just by a national or state-based press conference. It shines a big light on the fact that a community-centric response really hasn't been strongly activated in Australia. Those of us who work on HIV or are experienced with other epidemics in the past know that without that, you can't really sustain an effective response. So the 9 out of 10 Victorians who are going to work when they're ill and yet haven't yet been tested type thing, the Premier has probably put his finger on the pulse there. But most of the time, you won't know why things like that happen. You'll be guessing, and you need community-centric and community-informed research to tell you, and we've got to get our act together in that regard. OK, we've got to get our act together is a pretty good line. How do we get our act together? We were told early on in the pandemic that we were doing a really good job. We were almost showing off in some ways, and now we're thinking, maybe we need to make some improvements. What improvements do we need to make? Well, we did do a good job. Australia's done a fantastic job. Australia and the states and territories, many other countries would sort of give their right arm to be where we are 100 times better off than other comparable countries. But to sustain a good response, you can't just do it top down. You still need to maintain a command and control. It's an emergency type situation, but we have to live with this virus, with or without a vaccine and tests, for the next probably 1 to 2 years. And to do that effectively, to have people getting tested, complying with whatever the government wants, using masks, is going to need community-informed research. What do aged care workers, for example, tell us about what would work for them? What do those who live in high-rise apartments tell us what would work for them? That's a science, and that's a science that is quite sophisticated. It works in other fields and has not yet been activated in Australia. In your role, you tend to look at things at a macro level. How do you get large numbers of people to behave in a certain way? I mean, the sort of punitive approach, heavy policing, fines obviously can have certain results, but it's not always the most sort of community-spirited way to do it. How do you do it in a long-term way? Yeah, it's not so much about community-spirited or not. It just doesn't work very effectively. It has some effect. But these are always carrot and stick approaches. Yes, you get fined for not wearing your seatbelts, but it took a long time through sophisticated campaigns and community research to understand what it would take to have people take up that obviously very effective intervention. Exactly the same is the case for, say, mask wearing or hand washing or social distancing, whatever the technique that we know works well, because this is the crux of the issue. We know that we have the tools in the toolkit to knock this virus on its head. We need the community to buy into that, not just one community that we might know well, Patricia, but the many communities we don't know very well that make up our many and varied parts of our society. They have to all be informed. They have to lead their own community's response. That's what behaviour change is about. And punitive measures will only go so far. In fact, they won't go very far at all. Do you think some Australian cities or states are likely to go back into more severe lockdowns? I mean, after all, there is still a very long way to go before this is over. In Melbourne, Greater Melbourne in the Mitchell Shire, it happened quite quickly because the outbreak got to a level that obviously they deemed it needed that kind of response. But do you think that's a certain inevitability across the country? I don't think it's an inevitability. It is quite possible. I'm quite worried about the circumstance in parts of Sydney and New South Wales at the moment. But we've learnt a lot more. The sorts of approaches that were taken, for example, in New Zealand, very heavy lockdown that we didn't have here. We had lockdown, but not that degree of heavy lockdown. We now know isn't necessary to make a huge impact. If you have good compliance around the measures we have now, that will work. And so I'd like to see us focus very hard on improving the uptake of the measures that we know work, rather than consider harder and harder lockdowns. But, is it possible? Yes. I don't think it's inevitable that other cities and places will need to go back into lockdown. How close are we getting to actually getting a vaccine that can be rolled out across the country? Well, it's a pretty good news story from my perspective, who's worked on vaccines all my life, and it is normally a very, very long road to get an effective vaccine. And to date, the many candidates that are being trialled all look quite promising. And so, there's every chance that there'll be a vaccine available in the world by the end of the year, and maybe a number of them, and I'm certain quite a number of them by next year. Just who owns that vaccine, and how much it's going to cost, and how easy it is to make, and all of that will depend on how quickly it's available to Australians. So that's something that we need to track very closely. As a rich country, I've no doubt we will get access, whatever the vaccine, pretty quickly. And my main concern is for countries, especially in our region and beyond, who don't have that sort of buying power. We need to focus very hard on them, both from a humanitarian perspective, but also COVID is never eliminated until it's eliminated from everywhere. So the biggest concern is vaccine access for the wider world rather than us.
And how big an issue do you think that's going to be? Because I've heard you say it, I've heard others make the same point, that this is access and economics and privilege is going to be key here. Do you think there is a sort of international commitment to try to deal with that, not only because it's the right thing to do, but because it's the thing that will work?
I do think there's an international commitment to do it, but it's a messy, complex, not completely fair and just world. So we will have to wait and see. But our government is one of a number who are determined to try to make that happen. Let's hope that when the rush comes to inject people with whatever the vaccine is, those at the bottom of the pile are thought of first and not last. We have to keep talking about it to ensure that happens.
Professor Crabb, thank you so much for joining us.
Thanks, Patricia.